Hello, hello, hello. Welcome to the Kathie J Show. So today I am very excited to have our guest on. This is Dr. Britt, Dr. Britt Beavis. She goes by Dr. Britt. And Dr. Britt, she's here because February is National Heart Awareness Month, and I am a heart failure survivor. And there are dentists, but then there are dentists like you, Dr. Britt. I have had so many dentists, but when I met you, when I got in your chair, it's a whole other experience. So, hello. Thank you for joining me today. And so let's talk about you and why you became a dentist. You're so good at it.
Thank you. And thank you for the compliment.
Yes.
As I joked with you, as much as in my clinical setting, I can be gregarious and bold, this is very outside my comfort zone. So I love you and I'm happy to be here as your nerd in uncovering the relation of oral health and heart health.
Yes.
I love what I do. And so I don't take your compliment lightly. And what I do is not always easy. Delivering bad news every day. Having someone come in, I don't want to be here. Me neither. Where do you want to go? I mean, it's a lot. And I also don't take it lightly because it's taken me 20 years to cultivate what you see and what you feel. I believe 100% in the power of healing the body and the mouth being the gateway to the body oftentimes, as far back as ancient cultures, looking at the tongue, looking at the consistency of the saliva. We've always done this, but now there's a profession for it. And I love being a dentist and I love taking care of you and all of my patients because it's brings me joy. It's design and it's the whole body. So thank you for that. It's taken a long time to figure out how to get here and I'm here. So thank you.
And you know what I really truly enjoyed about you, Dr. Britt, is just how you do the way you talk to your patients, the way you talk to me. It was literally like, well, you love yourself, right? Well, that's why we want to take care of you. Like, that's how you talk. Your bedside manner is amazing. Is this who you are?
I mean, we all have varieties of who we are, right?
Right.
There's I'm a lot louder out in the wild.
Yeah.
I'm a little more calm in my office, which my team would probably die of laughter that this is what I think is calm. But my whole life, inside and outside of my profession, is that wellness and it is that joy. I mean, joy is a state and it takes creation.
Yes.
I wasn't always this. It's easier for me and much more fun to be happy than where I was in my 20s and 30s. And it takes work. So yes, ma'am. And it's a lot more fun. So why not?
Yeah, your approach is awesome. You make an instant connection. And so let's talk about the connection between oral health and heart health, because immediately when I told you, you were like, you realize this is something serious, so let's talk about the connection between the two.
So the first thing really to your listeners and patients out there is what you and I have. It's having a connection.
Yeah.
Making sure you feel heard. I cannot stress enough, as human beings and as individuals, it is up to you to advocate for yourself in this healthcare system. So you fill out documents, you fill out paperwork. Does someone read them? They should, because in your paperwork was where you were treated as an individual, someone very different than the patient before you and after you. When we talk about heart health, when we talk about oral health or overall health, we have to be very careful to say correlations, not causations.
Yes.
Right? So is there a direct link? Only time will tell. But what we know is anyone who has gum disease is at least 2 times more at risk of having any cardiovascular event. They also are at increased risk for stroke, Alzheimer's disease, and pancreatic cancer. This is just the beginning. So there is a correlation, and we know this.
It's wild because our oral health, We are trained from kids. Well, hopefully you brush, hopefully you're flossing, you go and see your dentist twice a year. Hopefully, if your parents have insurance, but you don't realize Alzheimer's. Did you just say Alzheimer's can be in a correlation with? I mean, why is our mouth so important to the function of our body?
So, the main reason this mouth really is the gateway to the body, specifically the gateway to the gut. And as we know, there are many books about it now that are easily accessible. We have a head and we have a brain. The gut is the other. The body is sending us messages if we listen.
Yes.
When we look at the oral environment being the start of your GI tract, in my opinion, it's much easier to assess this end than the other.
Yeah.
It's a lot more comfortable.
Yeah.
A lot cheaper too.
Yes, it is.
So when we look at the mouth, it is a variation of soft tissue as we travel throughout the gut. And then as we know, being the second brain, the gut transmits so much information based on absorption, based on malabsorption to the rest of the body. How do we get nutrients? So in the mouth, there are a lot of messages. Consistency of saliva, and specifically what we're talking about today is inflammation. Inflammation is the correlation to heart health.
Oh, and it's not something I can just take an ibuprofen for. It's not that kind of inflammation.
You sure can. But it's best not to overload your system because this inflammation has been going on a lot longer than that ibuprofen is going to kick in for 6 to 8 hours. So what we look at as healthcare providers, specifically dentists and hygienists, is chronic inflammation.
Oh.
You can have inflammation because you had a steak dinner and some red wine.
Right.
When I do all those measurements, you may be a little puffier, you may be a little sore, but what we are looking at is chronic inflammation. If you have chronic inflammation in your mouth, you are 2 times as likely to have heart disease and negative effects involving your heart throughout your life.
It is a sign. It is a sign that's what's going on in real life in your body, right? Take it for real. Don't just think, oh, I made it through another dentist appointment.
No.
Without getting yelled at. Take it as a sign that your body's saying something.
And everyone wants to hear good news. We do. I was trained by all those old guys. Oh, you look good. Pat you on the back and you're out the door and you're like, what did I just paid for? What happened here?
Yeah.
We are measuring a level of disease versus a level of health. All of this starts with bacteria. So if we can get a little broad, not too gritty, not too granular, you can find those pieces of information from the Harvard Health publications, from the Cleveland Clinic. But when we look at the mouth, the body, we're covered in bacteria.
Yeah.
This mouth is not mine, but is a closed environment. Unless our mouth is open, unless we are talking, or unless we're sleeping, this mouth is closed, and that's what the bacteria love. These bacteria crave an environment without oxygen. So if you are not brushing at least twice a day, using effective means of cleaning in between the teeth, floss, a water pick, any sort of interdental cleaning device, using mouth rinses that are not acidic, but helpful restoring rinses. If you are not physically removing these bacteria, they are sticky and they are going to stick with you.
Yes. Yes, you're right, Dr. Britt. We're speaking today with Dr. Britt with Aspire Dental. Now, Dr. Britt, is it ever too late for your teeth? I mean, can we all come back? Tell us, there's always hope, right?
I love to be a yes person.
Tell me the truth.
There's a yes and. It's not always a but. There's a yes and, but you might be looking at a different alternative.
Okay. So like dentures or something yes. Okay.
Exactly. And as one of my great mentors states, dentures are not teeth. They may be the best replacement for your teeth.
Okay. Right.
So dentures still get bacteria.
Yeah.
You still have to clean them. What if you have dentures and you take medications and you have dry mouth? Those dentures don't feel comfortable. It's like shoes with no socks. We will run out of time in this body. We will run out of time with these teeth. We get 2 sets. One we lose by the time we're in high school, and then that last one you got to hang on to for, we're looking at about 80 years. So what are you doing? What are you doing to prevent moving down those train cars, because there is a caboose. And then what you're looking at is not the best option. Or if you go the dental implant route, you're looking at least $50,000.
Wow, that's a lot of money for you just to, if you would have just flossed.
I was going to say, how much did that cost you? 4 minutes a day?
So something else, that you were the first dentist to ever do this for me, Dr. Britt, and it has correlation with Direct Heart Health Awareness Month. You were the first dentist to give me a different Novocaine because I told you that I had a heart issue. You were like a shot, like something that simple. Tell me about that.
Yes. So what we use in dentistry to numb is called local anesthetic.
Yes, we all get it. And
right?
hopefully you do it really good. You shove it right. I mean, I didn't even know it went in. You're amazing with the shots.
So just for everyone's education, Novocaine is set in Hollywood movies. We don't use Novocaine anymore, and we haven't. We normally use lidocaine. But when someone has an elevated blood pressure or a history of heart disease and even diabetes, someone who's more inflamed, using a different anesthetic, one without epinephrine, is key. We are protecting your heart. We are not pumping you full of adrenaline. We're not raising your heart rate. We are not getting to a point that you could get uncomfortable, sweaty, or even worse. Have to call 911. Using an anesthetic without epinephrine is key. And oftentimes they work a lot quicker and a lot better, especially if we just booster them. Throughout the time we worked together, we took a little bit of time to check in to make sure.
Yeah, but it was amazing. It was the best experience ever. I always thought that the reason why you took our blood pressure when we get to the dentist is because so many people are scared of the dentist. I didn't realize it was a direct correlation to, we're not going to we can't help you if your blood pressure is too high. Have you had a lot of patients find out they were sick by coming to you first?
Not only with their blood pressure, but after we treat this gum disease, when you come back in 6 to 8 weeks for us to check on your body, if you don't heal, you are going to your medical doctor and you are getting a physical. There's a good chance you may have diabetes. So not only are we taking blood pressure readings that may irritate you because you're low at home, but you're high with us, it's to educate you. You're here for a service. Let us tell you what we're seeing. But also, if you don't heal, there may be something else going on.
Yeah, and that's just crazy. A lot of people would say, well, I guess when we go into the dentist for a while, that's the wrong thing to say, because the bacteria is continuing to build, get into your bloodstream, and hurt your body.
The key with this chronic inflammation is if it goes on long enough, there's a chance this bacteria could seed itself into your bloodstream. There's a chance that because you're inflamed, your blood vessels are going from the garden hose down to a straw, and all of a sudden one of those bits of plaque gets lodged in that straw, you're having a stroke. There's so many complications of letting that chronic inflammation go. You may never know because your body's amazing and it takes care of things. It doesn't tell you. We're the only ones who can tell you. We have a little measuring stick.
Right. So definitely you need to be honest when you go to the dentist, the doctor, with your history, because there's things that we're not even thinking about that you're thinking about. Could you tell me, why is it so important for you when you talk about health and people wanting people to be healthy? Why is it so important to you?
I like to be an advocate for what you may not know that you need or that you want. I like to think that I'm a less annoying Siri. We don't have the best relationship, me and my Siri. If you are in the driver's seat, Kathie J, and I tell you, I'm going to be over here, I'm going to be your co-pilot. I'm not going to nag you. I'm not going to annoy you, but you came to me for a reason. I'm going to tell you my findings. I'm going to tell you what I see. What did you come here for? I better do my job. Oath number 1 is do no harm. I'm going to sit over here and be quiet. I'm not going to harm you, but I'm going to gently guide you where we need to exit, where we need to do treatment. That is so important to me because I was not trained that way. I was told, you need this, go do this.
Yes.
No. People don't need a lot of things, but we do need health. We do need health to be happy, to feel good. So that's what I love. I love helping you. I help you be in an active work moving forward and getting healthier. It starts here. It's the rest of the body.
No. Dr. Britt, you're amazing. We're speaking today with Dr. Britt at Aspire Dental. Aspire Dental has locations all across the Denver metro area. Dr. Britt's office is in Northfield, and she is accepting new patients so you can get this amazing treatment and feel. It's not like a Mother Nature feeling that I have with you. I just, like you said, the fact that you even described it as we're on a journey and I'm going to tell you where we get off. You're like, this is where we're getting off. Like that is never told to us. It's just this, and this is how much it's going to cost. But your office, I mean, that your girl at the front, Jaleesa, I would like to give her props. She is like a walking Rain Man of insurance and what is covered and this and that. I mean, you guys really take so much stress out of coming to Aspire Dental. And so I just wanted to say thank you because I like the little blanket you put on me. I like the fact that you keep putting cocoa butter on my lips. You have all the technology. Dr. Britt, you make it as comfortable as it can be because you know how stressful the dentist is to people.
Absolutely.
Yes.
This people tell their dentist more than they tell their priest.
What?
If you lay someone back and put them in a vulnerable position physically, and then you put hands on them, they feel very close to you if they trust you. I have been to bat mitzvahs, I have been to weddings, I've been to celebrations of life, and I don't take it lightly after 20 years. So yes, Jaleesa is my girl.
Yes.
All of my patients are my
all of your
people.
patients. Well, I'm one too. Like now I want you on my show. I could use you every week. So thank you so much, Dr. Britt, for being here today. Thank you for talking about the importance between your health and your oral health and when it comes to your heart. I appreciate you very much. And is there anything else you'd like to say before I leave you today?
The biggest takeaway is taking care of yourself. It's never too late. And there is so much shame. There's so much shame in this world. Don't do it to yourself. Find someone to help you. Find someone to be your co-pilot in your Siri. Taking control takes effort and it takes time and unfortunately money. Find a place that will help you with all of those, that makes time for you, that listens to you and works within your budget, builds out that long-term roadmap. Letting go of shame we put on ourselves is the hardest thing. So step away from it. It is on the other side of fear that you will find health and you will find joy.
Got that right. Thank you so much, Dr. Britt with Aspire Dental. AspireDental.com is where you can find a location near you, but she's in Northfield. Dr. Britt, you're the best. You are making, we are the best projects we can work on. Have a great day. And thank you so much for your time.
Thank you so much. And I look forward to hearing from you guys again soon.
Yeah, we will. I'm going to use you again. Talk to you later. Bye.
Bye.
Kathie J.